Hello students, welcome to the online classroom of traditional Chinese medicine gerontology. We often hear the term depression. Well, depression in old age is also common in clinical practice. As a concept of Western medicine, depression in old age refers to a function-mental disease of elderly with abnormal emotional states and mental disorders. The main clinical manifestations are depressed mood, loneliness, inferiority complex, anxiety, delusions, cognitive dysfunction, delayed thinking and behavior, and a variety of physical discomfort symptoms. Think about it. How does Chinese medicine recognize and treat this disease? According to the medical records and the knowledge of the depression syndrome in internal medicine, we put forward the concept of depression syndrome in old age. The so-called senile depression syndrome refers to the symptoms of the elderly over 60 years old with depression, restlessness, chest pain, or even mental disorders as the main clinical manifestations. Its functional activities show inhibitory changes. Older depression syndrome generally has a longer course of disease. The onset of the remission alternates or it is not obvious, and the incidence rate increases year by year. Geriatric depression is closely related to Western medicine's senile depression, many including genetic factors, biochemical factors, aging factors, and psychological factors. In particular, it is related to the degenerative changes of the brain in old age and the various negative life events encountered frequently. Genetic factors mainly refer to changes in the biochemistry of the central nervous system caused by aging. Studies have shown that with age, the activity of catecholamine in the brain, especially norepinephrine, serotonin, dopamine content is reduced, and the function of acetylcholine is enhanced, which is related to the disease. The occurrence and development are closely related. Aging factors mainly refer to biological change unique to old age, such as brain atrophy, nerve fiber degeneration, central nervous system transmitter function decline, and endocrine system gonadal hormones and growth hormones, which lead to the integration of body information, and conduction function is reduced, and the ability to regulate the internal and external environment of the body is reduced. Among them, aging factors have a more obvious role in the onset of depression in the elderly. In the old age, the 5 internal organs are declining, and the yin and yang are gradually weakening. Etiology of Yu syndrome caused by 7 emotions include external causes and internal causes. Most of the external causes are emotional disorders, and the internal causes are mostly the combination of internal and external factors. The basic pathogenesis is liver depression and stagnation. The disease is in the liver and is closely related to the heart, spleen, and kidney. The pathological nature is mostly deficiency in origin and enrichment in symptom. The deficiency in origin is the deficiency of liver, spleen, kidney, and heart qi. Enrichment in symptom is different from qi, blood, flame, fire, and dampness. In general, there is a lot of excess in the beginning, and a long time of both excess and deficiency. In the early stage, it mainly shows liver depression and stagnation, liver depression, flame obstruction, qi stagnation, and blood stasis. In the later stage, it shows heart failure, heart and spleen deficiency, heart and kidney yin deficiency, heart and kidney yang deficiency. The diagnosis of senile depression syndrome is mainly based on the symptoms, medical history, and other organic diseases. Depression scale evaluation is an important basis for the diagnosis and evaluation of the severity of depression. The Hamilton Depression Scale is widely recognized and applied to quantify the patient's feelings, mental symptoms, and physical symptoms to help diagnose and guide drug selection. Electrocardiogram, heart CT, and hormone level measurement can help rule out depression syndrome caused by organic heart disease, cerebral infection, cerebral hemorrhage, intracranial space occupying lesions, and other mental diseases. There are 2 main points of syndrome differentiation. One is to distinguish sex yu. Pay attention to distinguish sex yu and its relationship with the internal organs. Generally speaking, qi depression, blood depression, and fire depression are mainly related to the liver. Food depression, dampness, and flame depression are mainly related to the spleen. And the deficiency syndrome is mostly closely related to the heart and kidney. The second is to distinguish between excesses and deficiencies. In terms of the treatment principles, resolving the stagnation of qi activity, regulating qi activity, and keep a good mood are the basic treatment principles. For 六欲, we use qi 活血, 降火, expectorant, moisturizing, etc. And for the deficiency syndrome, the method of restoring and calming the nerves was adopted. It is necessary to pay attention to the adjustment of the mind and tone yang clinically. The clinical manifestations of patients are mainly based on inhibitory changes, which are also caused by the decay of yang qi and yang qi stagnation in the elderly. Therefore, 宣阳开郁 is one of the most important treatments. Adjusting the mind is an important part of the treatment of depression. Tong yang can cure the mind, and the mind can adjust the mind. Rejuvenation can be carried out from nourishing the mind and calming the mind and relieving the depression. Okay, that's all for today. Next part, we'll study the syndrome differentiation and treatment of old age depression.